Hello, in this video I will be talking about giving consent for treatment, sometimes called informed consent. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out interesting content, so you can give us a suggestion, but we always have something new for you to watch. We've had a lot of comments from people saying they weren't informed about their treatment. So I just wanted to do a special video about this in particular. What is informed consent? In general, I'll be referring to written informed consent, where you actually give a signature. You provide your signature saying that you have received all this information and you agree to be treated having been given all this information. Some practices are using only oral consent, where you are given information and then you say you consent to treatment. That's not actually the standard at this point. So if you're treated in a practice where you did not sign consent to receive treatment, let your medical team know that you would like to be signing a written consent form. Informed consent tells you what to expect with treatment, what side effects you have, and will experience long-term and short-term. They will inform you that you can stop getting treatment at any point. And an informed consent document is really important because it goes home with you and you can reference that. What does an informed consent do? Well, it informs you. It also sets up a conversation between you and your medical team, whether it's your surgeon or the anesthesiologist that works with your surgeon, with a radiation therapy team, or with a medical oncologist or plastic surgeon. Frankly, any particular provider you see, if you're getting treatment with them, you will be signing an informed consent. This is different from a HIPAA authorization. A HIPAA authorization relates to your insurance. If you're in the United States, it's very likely you've signed a HIPAA authorization once a year, regardless of who's treating you, even before you were diagnosed with cancer. An informed consent, if you sign that, you are not waiving your right to bring a complaint against your medical team. You can actually, if something has been done that represents malpractice, you can take legal action. So you're not signing your rights away. Be really careful not to use that expression. In medical care, we don't sign any rights away. An informed consent pertains specifically to the treatment you're getting, and it protects the medical team so that they can say, we did tell you about this. Now, one of the problems with informed consent is that you're often signing this when you receive too much information to absorb. We have studies that have been shown patients are signing an informed consent and don't recall signing what was in that. So it makes sense, right? You're sitting in rooms, you may be seeing 3 providers in one day, the doctor's talking a lot of jargon, a lot of words you don't know, and you feel you don't have any choice but to sign this. You actually do. And I encourage you to ask your doctor, if they didn't give you a copy, to give you a copy. Take a look at it and you'll be surprised by how much is in there that you don't remember. Now, that's not the case for everybody. Don't yell at me in the comments. You may remember absolutely everything where you were told, but more likely than not, you don't remember everything. So it's really important you leave with a copy of your consent. Now, if you sign it electronically, you don't leave with a piece of paper, but it should be uploaded into your medical record. If your practice has an electronic health record, which the majority in the United States do, but not all, it may be on your portal. Again, ask for it. Let's say you were treated 5 years ago. Ask for the informed consent now. You want to see what you were told and see, did it miss some of the side effects that you experienced? Because we don't tell you every single side effect that occurred maybe in 1 or 2 people, because that's just too much and it is too overwhelming. The other thing an informed consent will do is say you were given other written information about your treatment, and that may also be true. So you might have signed a 3-page informed consent and been given 20 other pages about the other medications that you will receive. So informed consent isn't just a piece of paper, it's a process during which you get to ask questions and you are informed about what you will be receiving, what to expect, what the side effects are, and that you can ask questions anytime. It's really important to know that it's an ongoing process of care. So it's not just the piece of paper. It's the whole process where you are informed of what could happen, why you're being treated the way you are, and what to do if you have questions. I hope this is helpful. I've covered a lot. Your experience is likely to be very different from the person who's also watching this at this moment, or the person with whom you share this when you're done watching this video. Let us know about your experience. Put it in the comments. Ask us a question. It's really helpful to other people watching the video. And as always, thank you for watching.